We're going to finish up section 8, which is really, really long, with hypertension and hypotension. So we've talked about how the body regulates blood pressure, but let's look at what happens if this isn't working correctly. So if we have hypertension, that's really just an elevated blood pressure. When somebody has a consistent arterial pressure of 140 over 90 millimeters of mercury or higher. You've probably also heard the term prehypertension, which is when the pressure is elevated but really hasn't hit that clinical threshold yet. So blood pressure is constantly changing, but it should be temporary and for normal reasons like exercise or if you're stressed out or if you're sick, and that's not normally dangerous. But if we have persistent high blood pressure, then we start to do some actual damage. It's going to put strain on our heart, causing our heart to have to work harder to get the blood out to the blood vessels. And the heart muscle, especially your left ventricle, is going to enlarge or hypertrophy. And if we enlarge or hypertrophy our heart, it's going to actually make it weaker. Hypertension can also accelerate atherosclerosis, which is the buildup of plaque in arteries. And long-term effects are pretty terrible, so they can lead to heart failure, kidney failure, stroke, and a huge list of a variety of different vascular diseases. So we have primary hypertension and we have secondary hypertension. So most people with high blood pressure, so about 90%, have what we call primary or essential hypertension. And that means we don't really know what the single identifiable cause is. So instead, it's likely a combination of different factors like genetics and the lifestyle. So poor diet, age, diabetes, stress, smoking, pretty much any of those things can help contribute to primary hypertension. There's not an actual cure for primary hypertension, but it can be managed. So you can make some lifestyle changes like cutting back on salt, fat, and cholesterol, exercising regularly, quitting smoking, things like that. So doctors will usually try to prescribe some sort of antihypertensive medication, which have a variety of different ways of working. So some can relax your blood vessels, others will help your kidneys flush out more fluid, and some can even act to help slow the heart rate. But usually you have to do some sort of combination of both, making changes in your lifestyle as well as medication in order to get your blood pressure under control. But it is referred to as the silent killer because, again, a lot of times you don't see any of the symptoms until it's too late. So secondary hypertension, we don't have as many cases, so about 10% of all hypertensive cases are secondary hypertension, but it does have a clear underlying cause. So we know what's causing it, so usually the cure is going to be to go in and fix what was ever causing it to begin with if we can. So think of like things like kidney disease would influence that because of the RAS system that we just talked about. Even endocrine disorders like hyperthyroidism and Cushing's syndrome. In these cases, again, treatment isn't just about managing the blood pressure, but also fixing the cause of the underlying blood pressure condition. Hypotension, so this is the reverse. So when our pressure is too low. So typically it's defined as being lower than 90 over 60 millimeters of mercury. And unlike hypertension, hypotension usually isn't a major concern, especially if someone feels okay. So a lot of healthy people have a naturally low blood pressure, and it has been linked to a longer life and lower risk of heart disease. That said, chronic low blood pressure can be a red flag in some cases, especially if you have dizziness, fainting, or something like that, and low blood pressure. That could indicate that you have really poor circulation. So there are a few different forms that are known. We have orthostatic hypotension. This is one most of us have probably experienced. So if you've ever felt dizzy when you stand up too quickly, that's orthostatic hypotension. It is temporary, usually harmless, but more common in older adults. You can also have chronic hypotension. This could point to poor nutrition or some other source of underlying cause like Addison's disease, which is a disorder where the adrenal glands do not produce enough hormones, or hypothyroidism. And you can also have acute hypotension, which is just a sudden drop in blood pressure. This is a really, really important red flag, especially if it's a sign of circulatory shock. So circulatory shock is when your system pretty much fails. So it is a life-threatening condition, and it's where your blood vessels can't deliver enough blood to keep up with your body's demands. It doesn't matter how hard the heart pumps, if the vessels aren't filled properly or if the pressure is too low to actually move the blood, then we can have some sort of shock happen. So the first one's going to be hypovolemic shock. And this is going to happen when we have a large loss of either blood or fluids. So something like from trauma, surgery, or even if we're in severe dehydration. There just isn't enough blood volume in order for us to circulate our blood. The other one is vascular shock. So this comes from extreme vasodilation, where the blood vessels get too wide and the blood pressure is going to drop because of it, even if our total blood volume is normal. So a severe allergic reaction, in the case if we have anaphylaxis or septic shock, can cause this. The other one's going to be cardiogenic shock, and that happens when the heart itself fails. So in the event that you have a massive heart attack, it could lead to cardiogenic shock. So even with plenty of blood and still having decent blood vessels, your heart just can't pump correctly. So all of these forms of shock are considered medical emergencies, because if we don't have enough pressure and flow, our organs will start to shut down, and they will shut down fast. So making sure that you recognize and treat the underlying cause very quickly is critical to help prevent permanent damage or even death.